Hey there!
Choose this surgical therapeutic option if you want to give yourself the best chance to live longer after breast cancer surgical treatment. Which surgical procedure do I refer to? Let's explore to gain insights into the scientific evidence which guides treatment. It is worthwhile noting that every woman diagnosed with breast cancer has choices about her surgical treatment. But which is the best option in her circumstances? Let's explore the options and the available evidence about breast cancer surgery.
Here, we'll share what the options for treatment are.
There are two main surgical treatment strategies for breast cancer. The first is breast conservation treatment, or BCT. As the name implies, BCT involves preserving healthy breast tissue. In this procedure, the cancer is removed together with a rim of uninvolved breast tissue. There are many terms which mean the same thing. Breast conserving surgery, lumpectomy, partial mastectomy, wide, local excision, and quadrantectomy all refer to this same operation, where the objective is the full removal of the tumor with preservation of the non-involved breast tissue. After surgery, radiotherapy is usually recommended to complete local treatment. Local treatment is that which is for the breast and lymph nodes in the armpit. The other option is a mastectomy. This is an operation where the entire breast is removed. However, there are varying degrees of skin and nipple which may be preserved according to the preferences of both the surgeon and patient. After breast removal, the patient may elect to have reconstruction or not. There is also an option for a patient to request the removal of the non-involved breast at the same time as when a mastectomy is performed for cancer. This is medically termed as contralateral prophylactic mastectomy. Contralateral means the opposite breast from the affected one, and prophylactic means that the operation is done as a preventive measure. The process of removing both the affected and uninvolved breast can also be referred to as bilateral or double mastectomy.
Who are suitable candidates for BCT?
There are eligibility criteria for BCT. The first is the ratio of total tumor volume to total breast volume. This ratio may vary between surgeons, so it is best to discuss this with your surgeon. As surgeons, we would take into account the extent of the tumor in relation to the size of the breast. Personally, as long as the tumor is less than 20% of the total breast volume, there is a high chance that BCT will be successful. In general, for me as a surgeon, cancers smaller than 3 centimeters at maximum dimension are usually amenable to BCT. For larger cancers, there are treatment strategies which allow patients to downsize the tumors and undergo BCT. This approach will be discussed in another video. Next, since radiotherapy is a part of BCT, the patient should not have any medical reason to avoid radiotherapy. She should also be agreeable to undergo radiotherapy at a center accessible to her. Lastly, there are considerations for women who have done genetic tests and are found to have a gene mutation which places them at high risk of recurrence or developing a cancer in the other breast. This would require a special discussion with your doctor, and we will explore this in another video. The majority of women do not carry a gene mutation and will be suitable candidates for BCT.
Let's now discuss some data and evidence regarding BCT.
This team of Norwegian researchers analyzed the outcome of 13,015 women with early breast cancer and compared 5-year breast cancer specific survival for women who underwent breast conservation treatment and those who had mastectomy. 5-year breast cancer specific survival refers to the percentage of women still alive and have not yet succumbed to breast cancer 5 years after diagnosis. In all likelihood, these women will live for longer than 5 years after treatment. The 5-year breast cancer specific survival for women who underwent primary BCT was 97%, compared with 88% for those who had primary mastectomy. Therefore, for the same stage of cancer, 9% more women who underwent BCT would be expected to live longer than 5 years compared with those who had mastectomy. To summarize, women who underwent BCT had a better chance of surviving breast cancer than those who had mastectomy. A meta-analysis is a statistical evaluation of multiple studies on the same subject to investigate if findings are consistent across several studies. This recent meta-analysis provides evidence suggesting a survival advantage for women undergoing breast-conserving surgery with adjuvant radiotherapy for early-stage breast cancer compared with mastectomy. The authors state that the results should be interpreted with caution as there was significant heterogeneity between studies which span 24 years and are from different geographical locations. Nevertheless, the evidence suggesting a survival advantage for women with BCT should be shared with patients to support informed surgical decision-making.
This may surprise you.
But in certain instances, having a bilateral or double mastectomy is associated with significantly increased risk of breast cancer mortality relative to lumpectomy with radiation among patients with specific types of localized breast cancer.
Just one more recent study to discuss.
We chose this article to share because we feel that these researchers appropriately and eloquently echoed our philosophy. Their results showed that the survival time of patients who underwent breast-conserving surgery was significantly longer than that of patients who had mastectomy. So we recommend that women with early-stage breast cancer should work with their surgeon to find out if they are suitable candidates for breast conservation treatment.
We believe there is adequate evidence
for us to state that breast conservation treatment is associated with improved survival compared with mastectomy, and if a patient is eligible, choosing BCT increases the chances that she will live longer into her survivorship. See you in the next video as we explore more aspects of breast cancer surgical treatment. Cheers!